Thank you for joining us today. This is the 2025 Immunization Update webinar for WIC staff. My name is Grizel Cisneros. I am the Education Lead at Vaccinate Your Family. It is my pleasure to be here. We are going to be hosting this webinar. And to get us started, I am going to introduce Georgia Machell, who is the President and CEO of the National WIC Association. Georgia.
Thank you so much, Grizel. Good morning, everybody. I hope everyone can hear me and see me. It's wonderful to be with you all today. And it really is my privilege to be joining you today for this really important webinar. As Grizel said, I'm Georgia Machell. I'm the President and CEO of the National WIC Association. And every day I get to see the profound impact that WIC has as a cornerstone of public health in this country. While we're rightly celebrated for providing vital, healthy food, breastfeeding support, nutrition education, WIC's role really extends even further, and immunizations are a prime example. Now, in a time where science around vaccines is too often clouded by misinformation, the role of trusted messengers has never been more critical. And access to vaccines is essential, but families also need access to clear, factual information. And this is precisely where WIC shines and where you all get to shine. Immunizing children against preventable diseases is one of the most effective ways to help them stay healthy. WIC is a crucial partner in that effort. Our strength lies both in our reach and in our relationships. During a routine visit, staff may notice that a child is behind on vaccinations and then take the extra step of talking with parents about why vaccines matter and where to go for care. You all answer questions, you alleviate concerns, and you provide a clear pathway to protection. And this truly is public health at its best, proactive and preventative. By leveraging the trust WIC has built with families, you help ensure that every child, no matter of their income or their background, has the opportunity for a healthy start. At NWA, our mission is to strengthen WIC and support the vital work that you all do each and every day. We're so proud to partner with organizations like Vaccinate Your Family and federal agencies to equip local WIC providers with the tools and knowledge to continue this life-saving work. Together, we're not only nourishing bodies, we're building a stronger, healthier future for all children. Thank you for everything you do to make that possible. And thank you again for the invitation to kick off this very important webinar.
Thank you so much, Georgia, for being here. And thank you, everyone, for joining us. We have a jam-packed agenda. We're going to get started. We will have our guest speaker, followed by our patient advocate story. And then at the very end, we will have some time to address questions and answers. The Q&A box is enabled for you to pop in any questions you may have. If we do not get to that, we will make sure to post these answers on our website. Also, a quick reminder, we will run a 2-question poll at the end of the webinar, so please don't leave without answering that. First of all, a little bit about Vaccinate Your Family. We are here to protect people of all ages from vaccine-preventable diseases. That's our mission. We are at the center of the vaccine ecosystem. Between communication, policy, and community, we inform, empower, and activate this ecosystem to make vaccination possible. Before we get started, I wanted to share the resources that are available from Vaccinate Your Family for WIC staff and WIC clients. As we run through the webinar, I will share with you in the chat box the Vaccines 101 resource. This was updated recently, and it is very helpful when discussing vaccinations with pregnant women and mothers-to-be receiving WIC benefits. It provides key vaccination messages, and easy to read recommended immunization schedules. It also provides information to assist with vaccine screening and referrals. Alongside, we have also developed an immunization resource packet in both English and Spanish. This too was updated in September of 2025. It is easy to follow and a take-home packet for WIC clients. This is something you can give your clients to take with them. It is available as a PDF and can be easily printed. And finally, we are also very proud to host a wicchealth.org online lesson, which is also available in English and Spanish and was updated as of May 2025. Now that we have talked a little bit about the work of Vaccinate Your Family, I am very excited to present to you Dr. Theresa Chapple-McGruder. Dr. Theresa Chapple is Associate Professor and Director of the Center for Health Equity and member of the Faculty in Health Policy and Management at the University of Pittsburgh. She will be our guest speaker talking about protecting family health with vaccines. Dr. Chapel.
Hi, everyone. What a pleasure to be here with you guys today. I'm Theresa Chapel. I am a maternal and child health epidemiologist by training, which means that I try to prevent diseases, illness, and death that occur from the moment someone starts thinking about getting pregnant until all the way through pregnancy, the postpartum period, and for their children up until about age 5 is where my focus is. One of the easy ways to prevent illness, sickness, and death is through vaccines. And so I've spent a large part of my career ensuring access to vaccines, ensuring that people understand the need for vaccines, and pushing for vaccines that we have access to be available to more people. So, for instance, we'll talk a little about the Tdap vaccine later on. That's a vaccine that's available to prevent whooping cough for pregnant or for new moms, but that vaccine isn't really available to new dads. So I've been working the majority of my career to try and push and have more access to vaccines that would help the whole family and not just moms or people who they consider to be caregivers. I'm so excited to be with you guys today. WIC holds a very special place in my heart. As a young child, my father became gravely ill and died, leaving my mom, a stay-at-home mom, to wonder what to do about finances and how to make things work for her 3 children. And so we were young enough to be able to get on WIC, and WIC provided some relief to my mom, knowing that she could feed us nutritious food while going through all of the stresses that she was dealing with as a new widow and mom of 3 kids. I remember going to the grocery stores and helping her pick out which foods are eligible for WIC so that we could diversify some of the food that we were having. So I'm really excited to be able to um, talk with you guys and really uh, show that the work that you guys do is extremely helpful and can help with the whole career and pathway of the people who you touch on a daily basis. Next slide, please. The first major epidemic that I can remember in my life was the measles outbreak of 1989 to 1991. And I am a huge fan of history. And so when I'm thinking about where we are in our present day, I always look to see what did we do in the past? How did we handle things like this in the past? So I'm going to start off my talk by comparing and contrasting our approach to the measles outbreak of 1989 to 1991 to the measles outbreak that we're currently dealing with from 2024 and will likely go until 2026. So back in 1981 through 1990, 1989 through 1991, about 35 years ago, we had 55,467 cases of measles occurred during this time. This was a major outbreak, one of the largest of that generation. And these cases of measles came as a major surprise because at this time we did have vaccinations against measles. But one of the first things that the scientists were able to figure out was that we're seeing two main reasons for this outbreak. One was breakthrough cases, and the other was lack of vaccinations amongst certain populations. So a breakthrough case is when someone has been vaccinated for the disease and yet they still end up with the illness. Um, and then the pockets that we were seeing that were underrepresented and being vaccinated were young children and people with low income or financial barriers to getting the vaccines. What came out of this immediately was that in 1989, they changed the recommendation from a one-dose measles vaccine to two doses. And so in order to try and stop this outbreak, the goal was vaccinate as many people as possible so that we can start to see an end to this outbreak. One of the problems that we came across was that vaccine uptake wasn't exactly what public health officials wanted it to be at that time. There was skepticism around vaccines, there was concerns, and many people just did not take the vaccines as public health had hoped. What you can see here is really just different news clippings of stories about young people, adolescent children, all the way through children in colleges, were mainly impacted by this outbreak. There were deaths of about 166 people during this time. And in the city that I'm from, there were 11 deaths of children. Five of them were as a result of a religious sector that really shied away from vaccines. We've recently seen something really similar happen in Texas with their outbreak, and it being within a religious sector. One of the things that we could have learned from the 1989 to 1991 outbreak was how do we approach when different religious groups have different beliefs around vaccines, and what do we do about it? Because the same group that had 5 deaths in 1991 also had deaths again in this current outbreak that we saw over the summer. While there were 166 deaths during this time, about 1 in 4 people who ended up with the measles also ended up in the hospital. So we had high hospitalization rates, about 11,000 people, and the cost of this outbreak was about $100 million during that time. Next slide. This is an article that came out to talk about why we had such a major outbreak and what it is that we can do in the future. And if you just see the title, it says Measles Epidemic from Failure to Immunize. And I think this title would still be equally as relevant today as it was 30 years ago. One of the things this article points out, though, it says that part of the reason for the high outbreak was disappointing public response to community-based immunization campaigns. So one thing I want to point out is that as we are in these major outbreak periods, it's easy for our first response to be the people didn't do what they were supposed to do. People didn't get vaccinated, and that's why we are where we are. Instead of looking at the full picture, it wasn't just a disappointing public response to a community-based immunization campaign. It was also an underfunded public health system, a system that was not ready to jump in and have trusted messengers in different segments and different populations. It was an underfunded public health community that didn't know how to have messages to religious groups that might question the need for vaccines when they depend on God for all their healing. So I want us to think about as we continue to face outbreaks time and time again, I want us to consider what is it that we can do to be prepared for it? How can we become trusted messengers in our community so that as these things come up, we already have an end to our community. We have an end to our people. We understand their concerns and we're ready to jump in and provide them with the information that they need, and they're ready to receive it from us. This is something that we must do on a continual basis so that when it's the time of outbreak, we're already there and we're already ready. This outbreak, the last sentence on here is one that I think is really interesting. And it says that unless the level of immunization in preschool age children is increased, this type of epidemic will probably reoccur. One thing that I think is really big is that at the end of this outbreak, it ended with a call for action. And this call for action said, we must do something about this so that we don't keep seeing this time and time again. And I think that's one of the major things that we're not seeing this time around. We're actually seeing changes to vaccination schedules for children that will allow this type of thing to occur again. But let's go to the next slide. One of the major things that came out of that outbreak from 1989 to 1991 was that the call for actions came, money came. Our legislators got together and said, okay, we can't spend $37 million to address vaccine-related illnesses anymore in this country. We have to increase that. And so funding was increased 10 times that level. And a program called Vaccines for Children was created and implemented all within 3 years of this major outbreak. So by 1994, Vaccines for Children program became into existence and was funded to provide vaccines for low-income children, homeless children, children without a reliable sense of health insurance. And over the last 30 years or so of data that we have, over 117 million children have been born. 508 million cases of preventable diseases have been prevented. 32 million hospitalizations have been prevented, as well as 1.3 million deaths of children. So we can clearly look and see that vaccines saves lives, vaccines saves money. Vaccines are one of the greatest achievements that we have in public health. For every $1 spent on vaccines, we save nearly $11. Next slide, please. The Vaccine for Children's program started with about 9 vaccines that they were providing in 1994. And as of 2004, we're up to 19 vaccines that will be provided for free for children. This program also allows for, in times of outbreaks, for families to be vaccinated and not just children. We had a major outbreak of measles in 2024, and Illinois, Chicago, where I'm based, was one of the epicenters of that outbreak, and we were able to use the vaccines provided from Vaccines for Children's program to vaccinate anyone who was unvaccinated against the measles. What I want you to know about vaccines is that as science continues to advance, as we learn more vaccines are created. We're able to protect people from other illnesses, and that list continues to grow. I know for my mom, that was a source of concern for us as children. I remember hearing her say to the doctor, "Why so many vaccines? I didn't have to have so many growing up." And I think we have to be able to hear questions and not take those questions as an insult, but be able to really answer the question and see it as a form of curiosity, see it as a form of intelligence. Someone is asking a question because they don't know the answer and they're looking to us for clear and consistent answers. Thankfully, my provider was able to give clear answers, and my sisters and I were up to date on all of our vaccines. And while we were children at the time, and while 11 children in our community died of vaccines, died of a vaccine preventable disease, we were spared that because someone took the time to have a great conversation with my mom and make sure that she understood the importance of getting us vaccinated against the measles. Um, as new vaccine recommendations are made, they become picked up by the Vaccine for Children program, and it's allowable for those vaccines to be covered. I do want to say that the process is looking different in this current administration. The committee that was in place for decades to ensure that new vaccines were vetted and able to reach families and children. That process has changed a lot in the last current months as the new administration has put people on who may not have the best interests of science and the best interests of vaccines in mind. And so we're seeing different changes to recommendations that are not in line with where we want science, where science is. And so while ACIP recommendations were the gold standard prior to this administration, if you are wondering what the childhood vaccine schedules are, I would like to say that the AAP has really great graphics. You're looking at one on the screen that helps you know what the childhood vaccine schedules are. Also, different state health departments have created some consortiums where they are putting out good scientific information and making sure that communities know about it so that we can ensure that our children are still safe and that they're getting the vaccines that they should to remain safe. Next slide, please. One of the recent changes, this was from 2023, to the vaccine schedule was the addition of the RSV vaccines. And this vaccine is available for people over the age of 50, babies, newborn babies, and pregnant women. This vaccine is one that I wish was available maybe even just the year before. This picture that you see is my baby. He was born preterm in August of 2022. He stayed in the hospital for quite some time. And when we came home, it was 2 weeks into the start of the new school year. He has three older sisters who were waiting so patiently for him to be born and then for him to come home from the hospital. And his 4-year-old sister at the time had what my mom thought was a cold. And I knew to keep the baby away from the 4-year-old so that germs wouldn't spread, regardless of what it was, because the baby was so new, preterm, and already had issues he was dealing with. However, his 4-year-old sister was just so excited to meet him that she snuck in the room that we were quarantining in and staying away, and gave her baby brother a kiss. About 4 days later, um, he was clearly having complications from RSV, which is what it was determined that his 4-year-old sister had. And now my son had RSV and was having trouble breathing. We ended up back in the PICU and stayed there for an additional 2 weeks, where he had to get major interventions in order to be able to survive his bout with RSV that he received 4 days after coming home from the NICU. I am very happy that families do not have to experience what we went through. It wasn't just that 2-week hospital stay again. He also was on a breathing machine for the next 8 months of his life to deal with the complications of the RSV that he caught. These vaccines that we now have available to children that came just the following year prevent severe illnesses, prevent hospitalizations from RSV, so that there's families now that don't have to have the same story that I had about the complications that my son went through for his nearly his first year of life. Next slide, please. So I made this slide about 2 or 3 weeks ago. And the thing that concerned me at that time was the changes that we were seeing from the committee that I mentioned, ACIP committee, to the COVID vaccine recommendation and guidance. The changes that they were making were confusing. It wasn't clear who was considered to have an underlying condition, and who wasn't. It wasn't clear on what you needed to prove if you have an underlying condition in order to get the vaccines. It just really made access to COVID vaccines much harder. And if we think about it from the provider perspective, they were unclear on how much vaccine they should have because they don't know how many people are going to be eligible for it. And so it could also put us in a place where we have a vaccine shortage when we're trying to actually go get it for ourselves and our family. As I wrote this slide, we were entering into cold and flu and COVID season, and was really thinking about like, how likely will it be that we will be able to go get the vaccines we need for ourselves and our families as we enter the season. Subsequently, I went to try and get my COVID vaccine and was told that I needed a prescription and was not able to get the vaccine. I'm trying again today. I have an appointment at 2 o'clock. We will see if it happens, if I'm able to get vaccinated. But there have been major challenges, major concerns to how we get access to COVID vaccines. Next slide, please. There are vaccines that you can get during pregnancy. And as I mentioned, these are going to look different based off of recommendations by states as a result of what's happening with the ACIP committee right now. But it is recommended by ACOG that pregnant women get the flu vaccine and COVID vaccine to help keep themselves safe and healthy. And then there's vaccines that pregnant women can get that will pass through them to their fetus. And so it's good to get it because it'll allow protection for their fetus during the first few months of life. And that would also be flu, COVID, the Tdap vaccine, and the RSV. And next slide, please. One of the things that we have done in this country is minimize the impact of different viruses and diseases, and people then no longer see this as something important and something that they should take time out to do. So one of the ways we do that is by saying things like about the flu, like it's just the flu. Oftentimes, people who say that they have the flu really don't have the flu. They have a bad cold, but it's not the flu. And because we conflate those things, people don't really understand that the flu is a deadly virus, and it's one that we can prevent and should be preventing by doing our annual flu shot. So just in the last flu season, 27,000 people died as a result of the flu. 280 of those were children. Next slide, please. And then we minimize COVID by saying that COVID is just the flu. And what we know is that COVID is deadlier than the flu, even now to this day. The data is harder and harder to find about the number of COVID deaths due to changes that the administration has made to how the CDC tracks the data and reports the data. But what we can find is that about 50,000 people died during the COVID season of 2024-2025, with the lowest weekly death rates being about 150 and the highest weekly death rates being over 1,000. I remember the first time I told this to my mom when I was encouraging her to get her flu shot, her COVID shot. I told her that, 1,200 people had died the week before of COVID, and the shock look on her face, because this is information that is just no longer at the top of the news and people aren't hearing this. And so the thought is that maybe COVID has gone away and that COVID is something that we don't need to be concerned about. We are back into the seasons. So I'd like to encourage everyone on this call to get their flu and COVID shots and to encourage those within your sphere of influence to do the same. Next, please. I think I already talked about this, is that as recommendations are changing through ACIP, there's concerns about what that means and how it's going to be implemented in communities, and how if vaccines are going to be available and how available they're going to be to communities. So I'm thankful for all the organizations that are stepping up at this time to really fill in the gap. There's also been major funding cuts to vaccine research. Even things as focused on how to address vaccine hesitancy has been cut. And so we're putting ourselves in a position where we're going to be dealing with more and more illnesses as a result of vaccines not being available to certain age groups, but also not having the money and funding to do the work of addressing vaccine hesitancies within our community. Next slide, please. So how can you help? And being a trusted messenger, really making sure that you are helping people understand the importance of vaccines, the reasons why vaccines, new vaccines are added to schedules, and helping them know who are the right sources, who are the right people, where you can get good information from if you have questions. I think these are really prime areas where WIC staff can help support the uptakes that we need in vaccines at this time. Next slide, please. Here are some really good resources that I like, and I'm sure they're going to be made available to you guys, about how to reframe the conversation around child and adolescent vaccinations. These give you some really good talking points on how to have conversations with people who might be on the fence about vaccines, or even people who are anti-vaccinations. What I like to say and what I like to think as I'm talking to people who may have strong anti-vaccine views is that it's my job to plant the seed. It's not my job to argue. So as long as I'm giving them things to think about and listening to them and not being condescending, I think that planting the seed is good enough to be able for that seed to be watered and watered as you go over time. I started off by saying that I heard as a young child someone plant the seed in my mom that allowed for us to be vaccinated. And if that's a memory that I still hold, even if the parent never changes their mind, saying it in front of the children, saying it in ways that children can understand, it can help change their perspective as they go throughout their lives. Thank you so much. This is my presentation.
Thank you so much, Dr. Chapel, for this amazing presentation, as well as sharing your personal story. This is a group that really has the power to make a difference in our communities, in our families. So thank you once again for being with us. To our audience, the slides and resources will all be shared. After the meeting, you will receive a debrief email with all the information. Thank you so much. Continuing on with our agenda, we are going to our next presenter. And I did forget to say, Dr. Chapel is a Vaccinate Your Family board member. So thank you for that, Dr. Chapel, as well. And then we have another Vaccinate Your Family board member with us today to share her story as a patient advocate. We have Dr. Maurine Neiman. She is professor at the Department of Biology and Gender, Women's, and Sexuality Studies at the University of Iowa. Dr. Neiman, if you can please go ahead and start your video, and we will proceed to your slides.
Hey, thank you so much for the opportunity, and it's a real honor to get to share my story and that of my son JJ with this group of the incredibly important people on the ground with respect to access to vaccines and children's and maternal health. So yeah, my name is Maurine Neiman. I am here both as a scientist. I'm a biologist who's been working in evolutionary biology and genomics for the past 25 years. And as of February 2nd, 2020, I was also a parent of a child who died from the flu. So I'm going to share with you the story of what happened to my son and then what I've been doing after as I try to make meaning of what happened to my son JJ, how to move forward and how to make the most positive and good that I could out of a really horrible thing. Next, please. So my son JJ was born very happy, healthy, completely normal on March 10th, 2017. And he lived a really wonderful life. He was my first child and my only child when he died. And I had actually always been ambivalent about being a parent, but as soon as I had him, I was really glad that I had gone forward with having him. It was wonderful. We traveled with him. He was just a sweet, amazing kid. And so this is all the case until February 1, 2020. He got all of his vaccinations, including flu that year. He never responded strangely to vaccines. Certainly, he always was very normal course of infection when he had like all of the viral things that you get from daycare and so on. So there was no indications that anything might have been wrong or that he might have been especially susceptible to a severe outcome from the flu. Next, please. So on February 2nd, 2020, you can see a picture here of JJ that morning at 6:30. We woke up and we did a science experiment. We were looking at whether eggs float versus sink in hard water versus salt water. So we were learning about solubility and had a great time. It was a very typical morning. At 3 in the afternoon, it was actually a really warm, lovely, unusual day in Iowa City on February 2nd. So we actually had ridden our bikes over to get ice cream. You can see him right here. So 3 o'clock, we had gotten ice cream, and I think at this point he was maybe starting to come down with what we only knew after his death was influenza. But as you can see, his cheeks were a little pink, and he was starting to feel a little bit warm and a little bit tired, but nothing that seemed scary or out of the ordinary. So we took him home. My husband and I, JJ's father, Bennett, took him home. We gave him Tylenol. He perked right up as he had all of the other times we'd given him Tylenol when he had a mild fever. He had a temperature of about 101.5, so nothing scary or unusual. His temperature normalized. He ate dinner. He seemed sleepy and a little achy, so we put him to bed maybe an hour early after watching a movie. We had an audio and video monitor on him as always. He had no distress. He wasn't coughing. There was nothing that indicated that his lungs were affected. And I went to check on him at midnight because he had been quiet, and I found him dead with absolutely no warning. There was no struggle, no distress. And it was only after a very comprehensive autopsy that is required when a child dies suddenly and unexpectedly that we learned that he'd been infected with influenza. This is the H1N1 strain that caused the pandemic that killed many children in 2009, 2010. Now, he had been vaccinated, but of course, we all know vaccinations are the best we can do, but they're not perfect. And the flu vaccine is especially challenging because it's both a very difficult vaccine to match to a rapidly evolving virus, that is the flu, and because flu vaccination rates are abysmally low in our communities. They need to be something like 70, 80% plus in order to protect everyone in our communities. And on a good year, they might be 50%. So JJ was vaccinated, but we can't make everyone else get vaccinated. And he likely got the flu from someone who wasn't vaccinated in his daycare, and that killed him. And again, he was a happy child, no indication that anything was wrong, and we had no opportunity to intervene. I'm so grateful that we did vaccinate him because in doing so, my husband and I knew that we had done everything we could do and really the only thing we could do to really protect him from the flu. So this happened. It's absolutely the worst thing that, of course, ever happened to me. I immediately, I needed to do something to like fill the space that losing your only child leaves you. I wanted to make the most of his life and my abilities as a scientist and a science communicator and advocate, which I'd already been, but I wanted to do more in his name in particular. Next, please. So I am a biologist. I happen to be a biologist who studies the evolution of sexual reproduction. My focus is on a New Zealand snail that's very unusual in its ability to use either sexual or asexual reproduction. And so my team and I have sequenced the genome of the snail. This is our research team logo. But I'm only saying this to make the point that I am a biologist, I am a genomicist. And it's likely that the underlying mechanisms of these children, and there are hundreds who die every year in the same exact way with what seems like a mild viral infection, and they die in their sleep. We don't really know why, but it's likely that there's some sort of genetic vulnerability in these children. So I teamed up with some really talented clinician scientists at the University of Iowa, next please, to put our heads together and our talents together to try to identify genomic or genetic causes to these sudden unexplained pediatric deaths, which often, again, do happen in the setting of an otherwise mild viral infection. So we're working actively on this project right now. We have a number of families that are enrolled in our study, and I'm excited to see what we find. And I'm really honored that JJ and his genome are part of the study as well. So I certainly I'm putting my money where my mouth is, I think, here and in other aspects as well. Next slide. So I also am a long-term science advocate, and I am lucky to be at a large research university where we have incredible students who really wanted to work with me. They had known JJ and do what they could as well to try to make a difference and use JJ's life and his story as a force for good. So I teamed up with a number of my grad students. This was in 2020. So this is the COVID year. We got together though, nevertheless, and we actually put together an interactive online game that's available for free. It's really fun. It's this virtual flu game. We were sponsored by the incredible organization Families Fighting Flu to make this game really fun, really informative. It feels a little dated now since COVID happened, to be honest, but it was a really nice and powerful exercise in doing something to try to make good of a bad situation. And so this resource is still out there. I think it's a good one. It's especially fun for middle-aged kids. Please continue. I also have more recently, especially through my relationship with Vaccinate Your Family, which is an incredible organization. I'm so glad to be part of it. They teamed with the Coalition to Stop Flu last year to bring me out to Capitol Hill. This was, of course, during a different presidential administration, but I did go to Washington, D.C. I had the opportunity to share JJ's story with members of the U.S. Congress. And again, a tremendous honor, an incredible opportunity. And I guess I just hope that people who are nervous about vaccination or don't understand why it's so important, in hearing my story and that of JJ, can both understand in a visceral way that the flu, and along with other what we think of often, we trivialize these viral infections, can kill healthy children. It can kill them quickly and without warning, and also emphasize the key importance of vaccinating yourself, not just to protect yourself, but to protect the vulnerable people around you, like small children, like babies, like the elderly, like anybody who might not be able to get a vaccine or is immune compromised, and so on. So that was such a special opportunity, and I'm going to get to do it again actually in a few weeks this year. Please continue. I also, from the perspective of putting my money where my mouth is, I also have gotten involved in clinical trials to test out mRNA vaccines for the flu. I feel like if I'm going to be in the world talking about how important vaccines are, to really encourage people to get vaccinated, to engage with people who might be afraid of vaccination, it's really important, and it's important enough and it's safe enough that I'm willing to go and take an experimental vaccine, because I know that the process by which we test vaccines is good and it's safe. And the process by which these new vaccines come to the market is incredibly rigorous. So I've been involved in a stage 3 or a phase 3 clinical trial for the mRNA flu vaccine, and that also has been really fun, really meaningful, incredible to get to know the people who are involved in vaccine testing and to see how careful, how thoughtful they are, and how determined they are to make the world a better place through the implementation of these public health measures. Next slide. The final thing that I've been able to do is, again, take advantage of my position as a researcher and a scientist, is to, I developed and led the fundraising to endow a fund that is in JJ's name, where we provide grants to academics who have caretaking responsibilities to enable them to go to, let's say, a conference, and we give grants that allows them to hire a babysitter or bring a parent or something, so their child or the individual for whom they're caretaking can be cared for while this person can also go on to develop their career further. And this has been a really wonderful project to be involved in. I've been so honored to meet the various people, mostly women with young children who've been able to benefit from the resources that we provide. So that's what I have to share. I'm again so honored to be able to share my story with you, and I'm so grateful and appreciative of all that you all are doing to help keep women and children and pregnant people and our whole society safe, especially at this really difficult time. So thank you.
Thank you, Dr. Neiman, for that amazing presentation, as well as inspiring us. I think one of the purposes of this webinar is to really remind us that there are things we can all do in our own context. So thank you very much for that. We are now going to proceed to questions and discussion. I know the Q&A box has been open. I'm going to ask Barry to see if there are any questions that we can answer live in the next couple of minutes before we move on to our end of webinar poll.
Great. Yeah, thank you, Grizel. Theresa, if you wouldn't mind coming on camera again for us, we do have a couple that I think would be beneficial for you to answer with us. So the first one we got was asking, what are the, I guess, 1 to 2 misconceptions about vaccines you most commonly hear, and how do you respond to those?
The biggest one is that vaccines cause autism. And what people normally say is that, as you see, we've increased the number of vaccines we've given to people over the last 20 or so years. And at the same time, we've seen an increase in number of people with autism. And so I often talk to people about the difference between correlation and causation, that just because two things happened at the same time doesn't mean that one thing caused the other. I also talk to them about being cautious reviewers of science and knowing which type of science to read and take in. I do a lot of conversations around just understanding what a research study says and how a research study worked, in order for people to have enough background knowledge and understanding to be able to say, this is a credible study and this is not a credible study. So I'm thankful that there is so much research out there that really helps people understand that vaccines do not cause autism. But it really does take having one-on-one conversations, listening to people, and being able to show them true, incredible evidence and places to look and places where they could read more in order for them to change their minds. One big thing is that I don't expect people to change their minds overnight. When you're talking to people who are hesitant, when you're talking to people who have true concerns, you know that this is going to be multiple conversations, going to take a lot of time, a lot of patience, and hopefully it will result in that person being vaccinated. And you just have to be able to dedicate the time to people that they deserve to have.
Great, thank you. And the next question we have is very specific, so it may not be something you can answer directly, but may be able to provide a resource or direction. But we had a question asked of, what is the rate of death from influenza in different age ranges of children?
That's a good one. No, I do not have that data just right off the top of my head, but the CDC still does have influenza data on their website, and they have a tool that you can use to put in different ages, to put in different areas, and you can sort the data different ways to see influenza data. That tool is not there anymore for COVID data, but you can see it at least for influenza.
Thank you. That is all the questions that have come into the chat. If anyone has any others, I will allow, just a little bit of time, since we do have about 6 minutes left, knowing that we do want to launch a quick poll to get some feedback from everyone. But if you do have any questions, please do put them in. But as we do that, I'd like to just quickly ask both you, Theresa, and you, Maureen, just to, from my own personal perspective that I think will be helpful for others. If there's one big takeaway that you'd like to provide each attendee today and those who will eventually watch the recording, what would that be? What would you want them to take away? What's one big thing?
I think I would say to please use JJ's story to make people realize that the flu can kill their healthy young child and they will not have the time or the opportunity to do anything about it. And that the best way they can protect their child is to vaccinate themselves, and the best way they can protect their child is also to vaccinate the child and to vaccinate the people around the child. And that's all in the best that we can do right now.
I think for me, the one big takeaway is advocacy and the importance of advocacy. We've seen it work to restore a TV show recently. We know that it can work to restore science and the CDC back to where we need it to be. And so I would like to encourage people, as you can, to advocate. And it doesn't even have to be on a big scale. If that's not where you're comfortable, you can advocate amongst those in your circle, people who you know, people you have a spirit influence over. And let's work together for a collective impact to get our health back, and to not allow people to come in and change these recommendations and have negative impacts on our whole community.
Wonderful. Well, thank you both. Really appreciate you just taking the time to quickly answer some questions. Griselle, I'm going to turn it back to you to finish us up.
Absolutely. Thank you to our wonderful presenters once again, and to our entire audience for being here with us. This is a time of need for public health in general, for vaccines certainly, and we can make a difference. Last but not least, on your screen, you will see a 2-question poll. It is now open for you to submit your answers. Please go ahead and take the last couple of minutes just to let us know. This will help us ensure we're doing what we're supposed to be doing, bringing you the right information, and also planning for next year. This is an annual webinar. It happens every year. We are happy to be here, and we will have more answers and more information for everyone during the year as well. Things are certainly changing, and we want you to have the latest information always available to you. Again, you will receive the slides and all the resources that were shared in a debrief email. Thank you for attending, everyone.